When we talk about prevention in head and neck radiation, it's important to clarify that most patients will experience at least some side effects and often several. So prevention really means reducing severity, complications, and long-term impact rather than avoiding side effects altogether. This process starts before radiation begins and continues throughout the treatment. It includes dental evaluation, baseline swallowing, assessments, and thorough patient education.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Hello and welcome to the ONS podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Astrid Amoresano, Lead Oncology Nurse Specialist at the York Proton Center in New York City, about radiation side effects in head and neck cancer. This episode provides free NCPD contact hours. To receive credit, please review the episode notes for any guest disclosures before listening. Following the episode, complete the evaluation linked in the episode notes. Welcome and thanks so much for joining us today, Astrid.
Thank you so much for having me, Jaime.
Let's just start at the top. Can you give me a brief overview of the specific types of head and neck cancers that we see typically treated with radiation therapy?
So head and neck cancers that we usually treat with radiation are almost all the head and neck cancers, and they're usually categorized by where they are located anatomically. These include cancers of the oral cavity, oropharynx, hypopharynx, larynx, nasopharynx, salivary glands, nasal cavity, and paranasal sinuses. The most common histology types across these sites are squamous cell carcinomas, and many oropharyngeal cancers are HPV related.
Great. So all of them, it sounds like pretty much all of them, which that makes, that's okay. At least that helps narrow it down or not. So let's talk a little bit about why head and neck cancers are so often treated with radiation therapy, as you said, essentially all of them. So why is this therapy used so often with cancers that develop in the head and neck region?
Because radiation is very effective at controlling disease while preserving critical functions such as speech, swallowing, and breathing. Many tumors in the region are very radiosensitive, and radiation can be used either as definitive treatment or after surgery to reduce the risk of reoccurrence. But in many cases, radiation is combined with chemotherapy to improve local control. Because so many vital structures are located in this small, complex area, radiation allows us to treat the cancer while minimizing the need for extensive or disfiguring surgery. So that's the main reason why using radiation in this area.
Absolutely. And as you mentioned, there's a very narrow margin for error. Lots of critical structures, lots of healthy cells that if they are impacted by the therapy can cause some pretty significant problems. So when you're thinking about such a small, compact area with all these different organs and functions, it does make perfect sense that radiation, with its ability to be very targeted, very precise, is a popular and helpful modality for this region of cancers.
Exactly. In many cases, radiation offers balance between cancer control and quality of life.
So let's talk a little bit about the side effects that we see from radiation. What are the most common acute side effects that we see when a patient who has a head and neck cancer receives radiation as part of their treatment plan?
The most common acute side effects of head and neck radiation effects to the mouth, the throat, the skin, and the energy level. Patients often experience mucositis, pain or sore throat, difficulty swallowing, dry mouth, or thick saliva and taste changes. Skin irritation and redness in the treatment field is also common and can progress to dry and moist desquamation. Fatigue is another frequent side effect and tends to build as treatment progresses. Emotional and psychological distress are also very common in this patient population and can have an impact on daily function and quality of life. Side effects usually develop gradually, often beginning in the second and third week of radiation, and may be more severe or have an earlier onset in patients receiving concurrent chemotherapy.
And I think that's a really important point of the notion that many patients are receiving concurrent therapy. And so to acknowledge that some of the acute side effects they are experiencing could come directly from the radiation therapy, but it could very likely also be a blend of effects that they're experiencing both from their chemotherapy as well as the radiation therapy combined. And so understanding their full treatment plan and kind of all the different potential sources of those acute side effects really are important for nurses to have that awareness as they care for their patients.
Absolutely. And distress really plays a huge role in that as well.
What are some of the more common late or chronic side effects? So not the ones that they necessarily experience right as treatment is happening, but perhaps, shortly after or even maybe several weeks or months later.
Late or chronic side effects are typically related to long-term tissue changes following radiation. Common examples include persistent dry mouth, swallowing difficulties due to fibrosis, scarring, taste changes, dental problems, trismus, neck stiffness, and lymphedema. Some patients notice these effects within months after treatment, but while others develop it over time, over longer periods of time, sometimes years. And because late effects can evolve over time, long-term monitoring is really important. For some patients, it's very surprising when those late effects happen after such a long period of time post-radiation.
It really emphasizes the importance of preparing our patients as part of that education. Yes, focusing on sort of the acute symptoms or side effects that might appear, certainly the ones that are dose limiting or treatment limiting. But as you just said, giving them awareness that there might be issues that pop up later or they'll be dealing with for time that extends beyond the end of their active treatment phase, and giving them that sort of information and awareness up front so that they can kind of go into this treatment understanding kind of the full scope of what they can expect to experience or what might be possible. Are there any preventative interventions that we can use with our patients or recommend for our patients to help with some of these radiation side effects?
When we talk about prevention in head and neck radiation, it's important to clarify that most patients will experience at least some side effects and often several. So prevention really means reducing severity, complications, and long-term impact rather than avoiding side effects altogether. This process starts before radiation begins and continues throughout the treatment. It includes dental evaluation, baseline swallowing, assessments, and thorough patient education. As you already mentioned, education. Really, patient education is so important. And during treatment, proactive oral care, skin care, hydration, and nutrition are essential. We also focus on trismus prophylaxis with jaw exercises, as well as neck and shoulder stretches to help maintain range of motion, encouraging patient to continue safe swallowing. And it's really critical to keep those muscles active. The movement of swallowing alone uses so many muscles. And so it's really important to keep swallowing. And early involvement of dietitian and speech language pathologists helps support nutrition, hydration, and function. And just as importantly, these exercises and strategies need to continue after treatment and throughout survivorship to support the long-term recovery and the late effects we talked about before.
So when we are caring for our patients and they start to experience some of these radiation side effects that you've mentioned, how should we as nurses assess those symptoms? And are there any standardized tools that we should keep in mind as we conduct these assessments?
Yes, there are. So symptoms are usually assessed continuously throughout treatment with a strong focus on function. We are looking closely at oral intake, swallowing ability, weight trends, hydration status, pain, skin irritation, and overall oral health. And regular oral cavity assessment are essential to catch like mucositis, infection, or tissue breakdown, and so on. And to standardize how we assess and communicate symptoms, nurses commonly use the common terminology criteria of adverse events, also short, most people know it under CTCAE, to grade toxicities, along with patient-reported tools that capture how symptoms are affecting daily life. For example, the NCCN distress thermometer helps with emotional assessment because emotional assessment and practical concerns often go hand in hand with physical side effects. And additionally, excellent evidence-based symptom intervention resources, as you know, are also on the ONS website, where there are tools including guidance on skin toxicities, acute pain, mucositis, fatigue, constipation, and anxiety, anorexia, to name a few.
And that's such an important point of how we assess patients, and when there are available grading scales or other more precise, validated assessment tools available, depending on what side effect we're managing. Really important to use the best tool available and also use it consistently so that we can ideally pick up on the changes that sometimes happen gradually. Sometimes they are sort of abrupt, but the sooner we can identify as those symptoms are changing and headed maybe towards in the wrong direction, the sooner we can pick up on that, then the sooner we can implement certain strategies to help, as you said, maybe not eliminate the side effect they're experiencing, but to hopefully minimize the degree to which they experience it, to prevent it from becoming something very significant that would disrupt their treatment plan or cause any other more serious problems. So let's talk a little bit more about some of those management strategies. What are some of the things that we can do when our patients are experiencing these radiation side effects? Are there any management strategies that we can use specific to patients with head and neck cancer?
Generally, they're very highly individualized and symptom-driven. So, for example, pain management is essential so patients can continue eating and drinking. Supporting the energy level and maintaining hydration are also key, as fatigue and hydration can significantly worsen other side effects. Oral care protocols help manage mucositis, and nutrition support may include supplements or enteral feeding if needed. And then skin reactions are managed with gentle cleaning, moisturizing, and may require wound management in the late stages of treatment. Trismus prophylaxis, including jaw and tongue exercises, is important to help prevent range of motion and speech language pathology, plays a key role in maintaining swallowing function and safety.
As I listened to you provide that great response, it really just struck me of, you mentioned earlier that it's likely that any patient who has to receive radiation for a head and neck cancer is going to experience some, hopefully not, but even potentially all of these side effects that you've mentioned to a certain degree. And so really it becomes a matter of sharing and educating the patient and their caregivers about what to expect and also what our plan is, because we already have a plan. If they start to experience dry mouth or mucositis, again, we already have sort of the identified steps in place of what will happen when. And so to me, it sounds like it's a matter of, there's always that balance of you don't want to overwhelm or scare patients by just giving them the worst possible outcomes, making them feel like they're going to have the worst option, but giving them enough information to reassure them that we expect that these things will likely happen to a certain degree. And here's what we plan to do about it when we start to see those signs or before we see those signs. And so it really is this delicate dance of giving them enough information to feel prepared, but not so much that it's overwhelming or frightening, and just kind of walking through that experience with them.
Yeah, absolutely. And the goal is always to maintain function as best as possible.
And so how do acute and chronic symptom management strategies differ for our patients receiving radiation for head and neck cancer?
That's pretty straightforward. Acute symptom management focuses on immediate relief and preventing treatment interruptions, such as controlling pain and maintaining hydration and managing skin reaction, while the chronic management shifts towards long-term function and quality of life. This includes swallowing rehabilitation, dental care, managing the dry mouth that's often can turn chronic, and addressing fibrosis and lymphedema and trismus and so on.
Now, you've mentioned several times appropriately that quality of life can be a huge source of distress for patients. And so many of the symptoms, side effects that they might experience can really interact with or interfere with their normal eating and drinking and enjoying food, sometimes even breathing comfortably. And so there is a huge component of quality of life. I think a component of that we don't always talk about in as much of an upfront way is the sexual health or sexual side effects that can be disrupted for patients who are going cancer treatment for any diagnosis. And so specifically for patients who are receiving radiation therapy for head and neck cancers, how have you seen sexual health be affected by this treatment type? And how can we as nurses or other healthcare professionals help address these side effects for patients as they go through therapy?
Well, sexual health might not be the first thing nurses think of in regards to head and neck radiation, as you already mentioned. But even though radiation for head and neck cancer doesn't involve the reproductive organ, it can still have a significant impact on sexual health and intimacy, like fatigue, pain, dry mouth, changes in speech, and visible changes in appearance can all affect body image and relationship. Many patients also experiencing changes in how they eat, which can become a social and emotional burden. Going out to a restaurant with a partner or friends can feel distressing if someone can only eat soft or liquid foods, has drooling on one side of the mouth, or feels self-conscious while eating. For some patients, having a tracheostomy or feeding tube can further affect how they themselves make themselves feel unattractive and unsexy. So emotional distress often compounds these experiences. Nurses can support patients by normalizing these concerns, initiating conversation rather than waiting for the patient to bring it up, and acknowledging that challenges in intimacy, body image, and social interactions are common and valid. Sexual health and intimacy are closely tied to identity, relationship, and quality of life, especially when cancer treatment affects communication, appearance, and social routines.
You absolutely nailed it there about just normalizing it and opening the conversation up, being the first one to open it up, or even just suggesting that many patients have concerns or have challenges when it comes to their sexual health and their intimacy, and just letting them know that we hear this from other patients and it's okay if you want to talk about it. And if you don't, that's okay too, or you're not ready yet. But I think, again, we as nurses need to really own that we know patients feel comfortable with us. And oftentimes nurses have more time or have the ability to sit with and have these more slightly delicate conversations that can't necessarily be rushed. And so I just think it's great for nurses to always keep in mind that this is something that we should champion, of having these conversations and opening that dialogue so that patients feel comfortable and bringing up the concerns, if and when they have them, and just normalizing that it's something that we're able to talk about with them, and we want to help them address this part of their quality of life as well.
And often the patient won't bring it up unless we do.
Absolutely. And, you think of the hierarchy of concerns or questions or problems they might be experiencing. It might not be number one, if they can't eat or drink, or, they have mucositis, like it might not be the top concern, but it still doesn't mean it's not worth addressing and not worth probing them more to ask, is this something that's concerning to you, or to a point where you want to explore things that we can do to address it. I think it's just one of those things that we can't be afraid to ask the question and ask it repeatedly at different points in time when we see them, because it is something that maybe it isn't an issue with the first visit, but if this is their sixth visit, maybe the other issues have calmed down or we've addressed those. And so now this one has finally come to the top, and we need to be able to have these conversations with our patients too. So just a great topic for us always to bring into the conversation when we're talking about any sort of quality of life or side effect symptom management. We just always need to be able to have these conversations and move past the discomfort.
Absolutely.
Well, Astrid, thank you so much for joining us today on the podcast. I think we've had a great conversation about radiation therapy and head and neck cancer, and what are some of the commonalities we see with those patients that we care for. And so as we reach the end of our discussion today, we like to always run through just a series of quick questions to help highlight and summarize some of the key points that we've talked about. To start that off, how do you think healthcare professionals should evaluate maybe their own hidden or implicit bias they might hold about caring for patients who have head and neck cancer and they are receiving radiation therapy and experiencing those side effects?
I think healthcare professionals can start by reflecting on assumptions they may hold about who experiences side effects and how those side effects are expressed. For example, pain is often underreported or underestimated in certain patient populations, and cultural backgrounds can strongly influence how comfortable some patients feel discussing pain, distress, or changes in quality of life. So routinely using open-ended questions and incorporating cultural assessment into care helps nurses understand the patient's belief, communication style, and support system. It's also important to consistently include quality of life topics such as symptom burden, emotional distress, and daily function, because it's most important to do that consistently for all patients rather than just assuming who may or may not be affected by these questions.
And what are some common misconceptions about head and neck radiation side effects?
One of the common misconceptions is that side effects end when radiation ends. in reality, some effects peak afterwards or become long-term. Xerostomia or dry mouth and taste changes are good examples. While some patients improve, others adjust to a new normal where dry mouth and altered taste is permanent. Another misconception is that side effects are unavoidable or untreatable when many can be managed with early interventions. This is especially true for pain management, where fear of analgesics can delay treatment and make pain harder to control. I think ongoing nursing education helps patients set realistic expectation and stay ahead of symptoms, especially when it comes to pain.
And what's something about this topic that's not often discussed, but you wish people knew more about?
You might be laughing about it. So the long-term impact on daily life, I think, is really important, like eating socially, communication comfortably, or maintaining intimacy. Isn't discussed enough, but it matters deeply to patient. We already spoke about sexual health, but what's also often overlooked is the cultural and emotional and sometimes religious impact of treatment-related changes, such as loss of facial hair. For example, patients' facial hair is closely tied to identity, culture, expression, or religious practice, and losing it can be deeply distressing. Acknowledging these concerns, making space for those conversations, and when possible, even advocating for treatment plan adjustments to decrease dose to the affected area can make a meaningful difference in how supported a patient feels.
What additional training or education do oncology nurses need to stay current in this topic?
I think ongoing education in symptom management and survivorship care remains essential. There have been some exciting developments, specifically in the radiation oncology nursing education area. For example, the ONS has expanded radiation-focused education, including adding a dedicated radiation track to the annual ONS Congress and updating the ONS radiation course to reflect emerging evidence-based practice and standards. And in addition, the Oncology Nursing Certificate Corporation, or the ONCC, has launched the new Radiation Oncology Certified Nurse, the ROCN certification, which is currently in the beta testing phase and aims to be fully accessible later this year, which I think is really exciting.
Yes, we are very excited about that as well. And finally, are there any additional resources that you would recommend maybe for patients or even other providers who want to learn more?
First, there's the radiation-specific education through Oncology Nursing Society resources, like the Radiation Learning Library on the ONS website, which I think is great and keeps growing. Then there's the National Comprehensive Cancer Network patient guidelines, and it's really valuable because it translates evidence-based recommendation into patient-friendly language. I used it a lot. One resource I really like to emphasize is the American Cancer Society Head and Neck Specific Cancer Survivorship Care Guideline. I know it's a mouthful. They have developed that with the ASCO expert panel. It's providing guidelines on long-term follow-up and late effects. Additional evidence-based information can be found in journals such as the Cancer Journal of Clinician, the Clinical Journal of Oncology Nursing, and the Oncology Nursing Forum, as well as through professional organizations such as the American Cancer Society or the American Society of Radiation Oncology, and obviously big cancer centers like the Memorial Sloan Kettering and Dana-Farber, to name a few.
Well, Astrid, thank you again for joining us today on the podcast and sharing all this great information. I really appreciated all of your comments and your insights on an important population that not all oncology nurses maybe are seeing as often in the care that they provide, but certainly important for us to have these pearls of wisdom that you've shared. So when we do see these patients, so we can provide them with the best care possible. Do you have any final comments to share with our listeners today?
Remember that radiation therapy to the head and neck and radiation therapy in general is highly collaborative. Building and maintaining good relationships with your radiation therapy team, physicist team, dietitian, social work colleagues, speech and swallowing specialists, physicians, everyone in the care team, and knowing who your radiation safety officer is really, really matters. A strong, well-functioning interdisciplinary team can have a positive impact on the patient experience and may even influence outcome. That's what I believe.
Wonderful. Well, thank you so much.
You're most welcome. Thank you so much for having me.
Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.